Good morning, Mr. O'Grady. My name's Stephanie. I'm one of the nurses here at Broadfields Medical Centre. I'll be doing your health assessment today. How are you?
I'm doing well, thanks.
How's the weather out there today?
It's nice and sunny. I'm hoping to go for a fish a little later.
Oh, great. Looks like a really nice day for that. Is it okay to get started?
Yes, call me Bruce.
Are you sure that you're more comfortable with that?
Absolutely.
All right, okay, Bruce. How is your chair? Are you feeling comfortable? Is the room temperature okay?
Yes, I'm fine, thank you.
All right. Now, I just want to let you know that we have plenty of time here today, that I'm in no rush. We can answer all the questions at your own pace, take your time to have a think about them, and, everything will be comfortable and at your own pace. Is that okay?
That's fine.
All right. So did you walk here today? It's a beautiful day for a walk.
Yes, I did. I do enjoy a walk.
Yeah, me too. I'll let you know also that while we're speaking, I might be writing some things down, including some personal details. They're all confidential. No one will see them except for your healthcare team, and they'll only be used for medical purposes. Are you okay with that?
Yes, that's fine.
All right, let's get started. Can you tell me your full name and date of birth, please?
Yes, Bruce O'Grady, born May the 14th, 1953.
Bruce O'Grady, May 14th, 1953. And your address, please, Bruce.
47 Leafy Avenue, Broadfields 2173.
47 Leafy Avenue, Broadfields 2173.
Correct.
And Bruce, do you have a phone number?
Yeah, 0434 2000 66.
Excellent. And do you have any allergies, Bruce?
Yes, I am allergic to surgical tape.
Okay, thanks. Very helpful. So Bruce, I understand that you've developed a cough that you'd like checked out, and that you'd like some advice and help about making positive changes to your lifestyle so that you feel healthier. Am I right in that?
Yes, I'm concerned a little about this cough started a few weeks ago. I generally don't feel well. Sometimes I'm finding it hard to breathe. Just want to get a checkup, see if everything's normal and how I can start to feel a little bit better.
Okay, all right. Well, I think that's a great idea to get a checkup, and I'm really glad that you made the appointment. Let's start by telling me a little bit about yourself, and we'll go from there.
Okay, I grew up in Wagga Wagga. My mum's family come from the Wiradjuri people. I never knew my dad. I went to a Baptist school, but I left there at 14. It wasn't just for me. I still go to the Baptist church here in Broadfields though. It reminds me of home, and the people are really nice.
Great. Well, yes, school isn't for everyone, and that's fine that you made that decision. So the majority of families still live in Wagga, is that right?
Yes.
Okay, so it must be really hard having your family so far away, but it's really nice that you're keeping part of your home close to you by going to church and are keeping that part of your cultural life. And I'm glad that you know some nice people there. It's super important, especially when your family isn't nearby. And you said that your mum's family came from the Wiradjuri people. So do you identify as an Aboriginal Australian?
Yes, I do. Yeah. I do really miss all my family back in Wagga. Family is really important to me.
And do you manage to see them often?
I try to get back every so often as I can. I'll be visiting them again in January with my son and his children.
Oh, that looks like something. That seems like something to look forward to.
Yes.
Yeah. So, with your extended family so far away, can you tell me what kind of support you have here in Broadfields? You mentioned your son and some grandkids. Are you married?
My wife and I separated 2 years ago.
Okay. So, how do you feel about that?
It was quite stressful at the time. I've learned to get on with it though. My son Mark lives about 2 kilometres away. And he needs my help a lot because his wife died about a year ago.
I'm really sorry to hear that. May I ask how she died?
She had breast cancer.
You know what, that's a really hard thing to deal with. You've all lost someone really important to you, and your son is really lucky to have your support, Bruce. Do you spend a lot of time together?
Well, Mark works as a mechanic, and ever since his wife died, he picked up a few extra shifts at the local hotel to help make ends meet. So I'm looking after the kids after school, then 3 nights a week while he works.
Okay, so that's quite a lot, Bruce. Do you mind telling me your grandchildren's names and ages?
Lily's 12 and Ben's 5.
Oh, those are beautiful names. So Bruce, just let me make sure I've understood this. Your grandchildren, Lily and Ben, are 12 and 5 years old. You look after them every afternoon after school and also 3 nights a week while Mark does some extra shifts at the pub. Is that right?
Yes.
Well, it sounds like you're keeping really busy. I'm sure that Lily and Ben keep you on your toes. I have 3 children as well, and they definitely keep our hands full.
Yeah, they certainly do. I like to keep them active. That saves them from staring at the screen all afternoon.
Yeah, that's really good. What kind of things do you do?
Well, we take a walk to the park most afternoons, and I'll let them have a bit of a run around, and I'll take them fishing from time to time.
Yeah.
They love it, but I always get a bit burnt. I hate wearing sunscreen and hats, but it hurts later.
Yeah, well, that sounds like a lot of fun. And what about any other physical activity?
Well, I do a few laps at the local swimming pool.
Yeah, great. I love swimming laps too. It's great exercise, and it's really peaceful, I find. And it sounds like you're nice and active, which is great to hear.
Yes, that's right, because I am retired now, and it helps me keep busy and keep things off my mind.
Oh, and so before you retired, what were you doing?
I was a supermarket manager.
And you said that keeping busy helps keep your mind off things. So what kind of things are you worried about?
Mainly my health. Like I said before, I haven't been feeling well, and I'm a little worried whether things are normal. Okay,
well, Bruce, let's have a talk about that. I can see here that some observations have been taken.
Yes, I was a bit nervous about that. Is everything normal?
Okay, well, I'll go over these readings with you. It looks like you have a mild fever, Bruce. Your temperature is 37.9 degrees. Your heart rate's normal, so that's okay. You're breathing quite fast, which means that you can be having some trouble getting air in. Your breathing rate's 24 breaths a minute. And I remember you saying earlier that you were finding it hard to breathe.
Yes, I definitely am feeling a bit short of breath lately.
Okay, so it makes a bit of sense that your oxygen levels are slightly low. You should have a bit more oxygen in your blood, and right now it's at 94%. But we like it to be at 95%. But remember, Bruce, that these readings are only slightly outside the normal ranges. So I don't want you to worry or be anxious.
Why would this be?
Well, let's get to the bottom of it. I'm going to ask you some more questions, if that's okay. You a smoker or a non-smoker?
Oh, I am a smoker.
Okay, so can you tell me how many cigarettes you would have in a day?
I'll smoke a pack a day, maybe more if I'm having a beer or two with the mates at the pub.
Okay, so am I right in saying that you will smoke a packet of cigarettes a day and more in a social setting with your friends?
Yes.
Okay, so that's about 30 cigarettes a day if you're having the packet, and more if you're having a night out.
Yeah.
Okay, so would you like to tell me how many alcoholic drinks you might have each day?
I'll drink 6 to 10 a night. Again, I'll have more if I'm with a few mates at the pub.
Okay, so if you're at home, you'll have between 6 and 10, and if you're with friends, you'll have a few more than that.
Yeah, that's right.
Okay, and are you eating well? Can you tell me what a typical day of food would look like for you?
I'm no good in the kitchen. I'll never eat breakfast. I'll usually just eat pizza at McDonald's or KFC for dinner or lunch.
All right, so skipping breakfast and eating takeaway for other meals?
Yeah.
Yep, okay. So Bruce, regarding your diet, some things are going to have to change. I know that you wanted some advice on how to feel better, and I do think the things that you're putting into your body is what is making you feel so tired and unwell.
I agree.
Okay, so according to my notes here, you are a little overweight. Your BMI is 32.4. If you lost some weight, you might even reduce your blood pressure, which is also quite high at 184 and 70. And the bottom number is okay, but the top number tells me that your heart has to work too hard to ensure a supply of blood to the body.
So those numbers too high?
They are, but they are things that we can change. They don't have to stay that way. And I think everything here is linked, and we need to work out a plan to get you back on track. Okay? In terms of your diet, the food you're eating is not very nutritious. Takeaway is very high in fat and salt, and if you aren't eating any veggies, then your health is going to suffer.
I understand.
Okay, so is there anything that your religion or culture prevents you from eating? Do you have any restrictions?
No, I'll eat anything.
Okay, so good. The first thing I want you to do is to start having a good breakfast. What kind of things could you eat for breakfast?
I do like eggs. Cut toast is good too.
Excellent. So how about we try to boil yourself an egg and pop it in some toast, and that's a great breakfast. It will give you energy for the day. It will start good habits for the rest of the day. How does that sound?
Sounds fine.
Okay. And you mentioned that you're not that great in the kitchen, but how does a simple salad sandwich sound for lunch? We just have, 2 pieces of wholemeal bread if we can, some avocado for good fats, some lettuce, cucumber, tomato, a bit of ham for some protein. Not hard to do at all.
That actually sounds fine.
Okay, good. So, and dinner, let's cut out the takeaway. What we want on a dinner plate is some protein in the form of meat, veggies, and a small amount of carbohydrates for energy. For example, you can have some barbecue chicken without the skin, or a steak is a good choice. You can toss a salad together, or you can chop up a few veggies, steam them in the microwave or on the stove. Add some rice, that's pretty simple to cook, and some sweet potato, and you have a lovely, delicious, well-balanced meal. And I do know that the neighbourhood centre has some cooking classes each week. And this could be an awesome way to get confident in the kitchen. So do you want some information about that?
Yes, please.
Okay, so here is some of the times for the neighbourhood centre cooking class on Monday, 11 to 1, Thursday 7 to 9, Saturday 11 to 1 as well.
Okay.
Okay,
Thank you.
they'll give you some tips.
That's good. Thank you.
Bruce, if you feel like you need a snack, fruit is a great choice. And avoid those fizzy drinks because they're really high in sugar. Water's the best option, which brings me to your alcohol consumption.
Yeah, it's a little much, right?
Well, the guidelines state that any more than 2 standard drinks per day can increase the risk of alcohol-related health problems such as liver damage.
And here I am having about 10.
Yeah, so I think it's best to cut back. Let's set some limits. What do you think is reasonable?
Maybe 4 drinks.
All right, so let's say in the interest of cutting down, we'll try reducing it to 4, and then we'll aim to cut it back even further to 2 over time.
Sounds fair.
Okay, so if you're having 4 drinks tonight, let's try and make them light beers, or something with lower alcohol content. And if you're at the pub with mates, can you make every second drink a water or a soda?
I can definitely try. I really want to start feeling better. If this helps, then good.
Okay, great. So now the hard part, smoking. Now I know that smoking is an addiction and you're going to have to work really hard to give this up. It's important because it's really affecting your health, and it could be what's causing your cough or stopping your cough from getting better.
I've tried so many times. It's just so hard.
Yeah, I know. And it's not something that you should do on your own either. You need support for something like this. So here's the number for Quitline. It's a number that you can call. You get some help and support, advice and tips when you are giving up smoking, and ways to stay on track. Okay?
Okay, thank you.
And do you know anything about nicotine replacement therapy? It's a way to wean yourself off nicotine gently so that your body doesn't have too much of a shock when you are giving up smoking, and it keeps the cravings away as well.
Okay. Is that all I need to see the doctor for?
Well, I'd like to book you an appointment with the doctor,
Yes.
because some forms of nicotine replacement therapy require a prescription, and you can talk about what best suits you.
And anything else at all with the doctor?
I'd like you to have a check because you are showing some signs of a mild infection. Your temperature, respiratory rate, and they're a bit high. Your oxygen is slightly low. Plus with this cough that won't go away, it's possible you may be getting ill and you might need some medicine. So I'll book you in with our doctor this afternoon. How does that sound?
Oh, that sounds fine. Thanks very much.
Okay, great. So are you able to come back at 3 o'clock this afternoon?
Yeah, definitely.
All right, I'll write that down on a card.
Thank you.
It's Dr. Smith, and she will see you at 3 p.m. Just come back here.
Thank you.
All right, so you can sort those vital signs out with her.
Thank you.
I'm really happy that you are swimming and fishing and walking. Those are great forms of exercise. But it's so important that you use sun protection, because you told me that you're not too keen on that either.
But it's
And you get burned a lot.
It's so annoying.
I know, but the Australian sun is dangerous. And it's really strong, and we have one of the highest rates of melanoma in the world. Melanoma is a really dangerous skin cancer, and it's totally preventable. So, if you're swimming or fishing or doing anything in the sun, I would like to see you wear a hat and sunblock. Does that sound okay?
I suppose you're right.
Okay, all right, good. So we've talked about your diet, we've talked about your alcohol intake, and we've talked about your smoking. We've agreed these things are definitely affecting your health. So let's go over what your plan is.
So I'm going to try to cut down to 4 beers a night and make them light beers.
Yep.
I'm going to eat a healthy breakfast and try and make healthy food instead of just buying takeaway.
Yep, excellent.
Going to give up smoking.
Great. And the doctor can help you with that. And you can talk to her about nicotine replacement therapy, and the doctor is going to check you over and see if you're getting sick or not. So I'm really happy to hear that you're willing to make these changes. Improving your diet and improving your other habits will lower your BMI, probably your blood pressure too, and just an idea that if you feel tempted to have more to drink or to smoke, maybe it's best to stay away from the pub, because you mentioned that you went to church and to an Aboriginal youth group.
That's right.
Okay, so these are better places for social support, and you won't be tempted to drink or smoke there.
That's true.
And there are places that you can include your family as well.
That's true.
And I know you're seeing a doctor today, but I would like to see you again in 2 weeks' time to see how your plan is going.
No worries.
So you have some homework, Bruce. Let's see if you can check out the cooking classes for ideas. The number for Quitline if you feel that you need it. You're seeing the doctor this afternoon about nicotine replacement therapy, and to check out whether you have an infection.
And I'm going to keep active and start using sun protection.
Yes. Okay, that sounds great. Do you have any other questions or anything else that I can help you with?
No, I think you've covered everything.
All right then. So are you feeling okay with what we've talked about?
Yes, but there's a lot of changes to make.
Okay, yeah, it's true, but we will make them slowly. You'll have support from us, and over time you'll start to feel much better, which is what we want. When are you free to come and see me again? 2 weeks is a good time frame.
2 weeks, that sounds fine with me.
Okay.
Thank you.
All right, so we'll say this day, 2 weeks, in 2 weeks' time at 11 a.m. again.
That's fine,
Yep.
thanks.
Okay, great. All right, I'll write it down so you don't forget.
Thank you.
Good luck with the doctor this afternoon.
Very good. Thank you very much, nurse.
Thanks, Bruce. I'll see you in 2 weeks.
Lovely to meet you. Thank
You
you.
too.
Bye-bye.